Joining us is Dr. Walter Kasadi Mulombo, the WHO country representative to Nigeria, as he talks to us more about the trends of the coronavirus across the world. Thank you for joining us on the program.
Thank you for having me in the program. It's a pleasure.
Dr. Kasadi, how is the World Health Organization responding to the needs of the African continent, low-income countries, to procuring more vaccines?
Thank you for your question. Yes, it's a huge concern for WHO to see that the African continent is still lagging behind in terms of accessing COVID-19 vaccine. Right now is really around 0.3% of the population in Africa that have access to COVID-19 vaccine, and yet there is more than 3 billion doses already distributed, mostly in high-income countries. So WHO is working with all the participants to the COVAX facility, which is a platform sponsored by WHO, CP, UNICEF and Gavi, to ensure access to vaccine in an equitable fashion. So we are working with all the players, but also stepping up our advocacy, reaching out to high-income countries so that we share the doses of vaccine and help Africa and other low-income countries and region to access the vaccine. As we said over and over again, no one will be safe until everybody is safe. And we are hopeful that in the coming months, the situation might change. We are also working with manufacturers to try and waive the patent so that we could expand the capacity for local production in other places. And like you know, there was already a step into that direction with the establishment of the vaccine manufacturing hub in South Africa recently. So it's a work in progress, and we are hopeful that with adequate advocacy, we will come up with some concrete strategy. As you know, WHO is calling for all the region, all the country, to ensure that at least 10% of the population are vaccinated by September, and 40% by December. This will help accelerate the pace to immunize the population and hopefully come out of this acute phase of the pandemic. Over.
There are certain professors of medicine who have talked about Nigeria having a peculiar case such that they're saying that we might not actually need the much vaccines based on perhaps WHO measures, you know, to getting herd immunity. And this is because of perhaps our numbers. What do you think about that?
Sorry, what the professor said?
So the professor was talking. Yes, the professor was talking about. He's saying that, you know, we have a peculiar outbreak in terms of the number of cases we're recording, also the number of deaths and the number of people that are recovering, so that we might not need to spend so much on procuring vaccines.
Yes, it's true that the Nigerian COVID-19 response is one of the best. We have been able to avert the doom that was predicted, but we have to remember that it came as a result of drastic measures that were put in place by the federal government and collaboration with the state. Strong measures were taken very early when the pandemic first hit Nigeria. So we have a positive experience of implementing public health and social measures, and they worked. It shouldn't be the reason to be complacent. So we really need to immunize as many people as possible to ensure that herd immunity is established. Of course, the debate of buying the vaccine versus not buying them, it can be there because of the low number. But we have to remember that we haven't reached yet the capacity of testing that will be able to detect all cases in Nigeria. And we are not secure yet in the front of variant that keep emerging. So it's very important we we use all the tools available. It's not social measures alone. It's not face mask alone. It's not the vaccine alone. It's all these measures until the whole world will be safe. This is what I can say about that statement for that professor. Over.
How much of a threat would you say the Delta variant is, which appears to have already surpassed the Alpha variant? I mean, do you expect that, public health, I mean, this will impact public health measures of governments? And this is looking at how, a lot of the African countries are experiencing the third wave and looking at, Nigeria's situation.
Yes, the Delta variant is very dangerous. It's highly transmissible. It has the potential to increase transmission quickly in the population, but it remains sensitive to all public health measures that were put in place. So Nigeria needs to remain on high alert to avoid the third wave. And we are surrounded by countries that have started seeing those increase. So we shouldn't be complacent, if I can say it in one word. The danger, the risk is still there, and we need to continue, including securing enough vaccine for the population. As it was already planned through the Presidential Steering Committee on COVID-19 vaccine. So I still believe that Nigeria needs more vaccine and more people need to be reached and immunized.
Finally, before we let you go, the Director General of NAFDAC said that the WHO is auditing the agency so that Nigeria can begin the production of COVID-19 vaccines. I mean, has there been an outcome of that audit?
WHO is working with the Nigerian government to assess the readiness and the capacity for local manufacturing. We have a maturity level for different countries, and recently we have reassessed the capacity of NAFDAC in terms of securing safety of medical products. On the other hand, we know that Nigeria has got facility. Nigeria used to produce vaccine in the past, and those facilities could be upgraded for Nigeria to produce vaccine locally. So WHO is in touch with the national authority. We are aware that there are plans to scale up the local production capacity, and as part of our mandate, we are willing to continue to support Nigeria to establish that capacity. It will go a long way, giving the population, giving the capacity already on ground and the history. Nigeria should be able to establish local production capacity, which will be good not only for the country but for the region. Over.
All right, we'd like to thank you. Dr. Walter Kasadi Mulombo is the WHO country representative to Nigeria. Thank you for joining us on the program.
You're welcome.